what has emerged really as the epicenter in the world, the United States, New York in particular, very, very badly hit, and President Trump already warning that the next few days are going to be extremely tough. Professor Siddharth Chandra from Michigan State University joins us via Skype at this hour. We'll also be joined by Dr. Samir Garyali from New York in just a couple of minutes. Professor Chandra, thank you very much for joining us. Just wanted to first get a sense from you overall, where, the trajectory is in the United States where you are, and when you look at how India is progressing on this, what's your overall sense at the moment? How badly are we doing or not? How do you see it?
So let me start by saying the United States is a little bit further ahead in time and progression in this pandemic than India is. Like India, the United States is a very large country geographically. And so what's going to happen is we're going to see the pandemic playing out in different states of the US at different points in time. And while today New York may be the epicenter, a city much closer to home for me, Detroit, Michigan, has emerged as a second epicenter. And I think we're going to see epicenters emerging as the pandemic moves across the country. I think India has the benefit of having come into this pandemic later than a number of other countries. And I think with the speed at which information and best practices can be transmitted across the globe now, we have a lot of information coming from other countries. And I think a number of the steps that the government and corporations and individuals have taken, I think reflect the wisdom of the experiences in a lot of other countries. So I think India is on the right track. This is not to minimize what's going on. It's going to get much worse before it gets better. And I think people should expect that. But I think the government and the private sector are taking the kinds of measures that they should be taking.
As far as, stringent lockdowns are concerned, it's interesting because, India has got more than 1 billion people locked down. And you have the United States where you have, I think now, 75% of the population in some kind of sort of shelter-in-place orders, but there's a substantial population that is still moving out and about. Is that a mistake you think that the US is making? But at the same time, do you think that such harsh lockdowns can be sustained? That we need to find alternative ways to deal with this?
Right. So I think the lockdown was absolutely critical to managing the pandemic. And the reason it was critical is we had this initial wave of infections and unfortunately the mortality that goes with it that needed to be brought under control, right? Now, of course, there is economic fallout here, just as there is in India. So in the most recent week, if you look at unemployment claims, an additional 6.6 million people were added to the unemployment registers in the United States. And this is a record by far, if you look at graphs going back decades. So obviously, the lockdown is economically unsustainable. And I think once this first wave is brought under control, a key focus is going to be, because these lockdowns actually result in the maintenance of a pool of what epidemiologists call susceptible people. We've been protected, we have not been infected, and so we are vulnerable going out into the future. So a very important strategy is going to be how to calibrate the relaxation of the lockdown so as to start economic growth up again, without endangering large enough segments of the population that the medical system is overwhelmed again.
So step by step, you also would advocate a step-by-step approach. Finally, can I ask you that are you, I'm just looking at some of the headlines today. The new infections and deaths in Spain and Italy in recent days have fallen, which suggests that the lockdowns there may be working. And does that give you some hope that, some of the worst hit countries in Europe might actually be turning a corner? Maybe?
Absolutely. And Nidhi, you mentioned New York. There are hints. It's still a little premature, but there are hints in the media now that we may have hit the peak or maybe coming close to the peak even in New York City. Now, it hasn't even begun to take off in other parts of America. And this is a large country like India. So I think we can expect similar types of developments in some other places, unfortunately.
All right. Well, Professor Chandra, thanks for speaking to us. We'd love to talk to you again in a few days, maybe a week from now, to see where we stand, because I think this week is going to be crucial for a lot of us, you there in the US, as well as all of us folks here in India. I want to go across to Dr. Samir Garyali from New York, MD and interventional cardiologist, joining us via Skype from there. Dr. Garyali, just wanted to get a sense from you. I mean, New York has emerged as sort of the the epicenter of all of this in the world now. How are doctors coping? Because one is hearing a lot of horror stories about just, in a country like the US, in a city like New York, facing shortage of very basic equipment.
Yeah, hi Nidhi. So things are not what we want it to be. Obviously, we're facing a pandemic, and we're facing things that we never thought we would be facing. We first of all don't know what we're dealing with. That's the number one thing. Second of all, we're starting all these treatments that we don't even know if they're going to work. And finally, we're dealing with very limited resources. We know we have a certain amount of ventilators that we can use. We're getting very close to that. We know that our medications are kind of running out. So these are our challenges right now. And we're constantly playing catch up with the virus. It's not like we were ahead in the game right from the beginning. So these are the challenges that we're dealing with right now. Hopefully moving forward, things will get better. And we are turning a corner. Our death rates have actually, for the first time, not been that high for a few consecutive days now. But again, this whole numbers game is difficult to predict, so we'll see how it goes.
So you're saying that perhaps you might be sort of inching towards the peak cases in the next few days, and that's why do you also agree with Professor Chandra that the next week or so is going to be crucial for you as well?
Absolutely. I think we will probably, again, like I said, nobody's an expert on this. Nobody knows how this will actually pan out, but we feel that we are very close to the peak. So I'm assuming in about a week and a half, we'll be hitting the peak. The problem that we're facing is, how do we deal with that? How do we deal with how do we deal with the peak in terms of all the equipment that we have and the resources that we have? And that's one of our struggles right now.
How are young doctors like yourself coping in these situations? I mean, I've got family there, they're doctors too, and I know how much of a struggle it is right now. So how are you guys doing under the circumstances?
It's extremely tough, but what's interesting is that in a situation like this, the emotions kind of take a backseat, and you do what has to be done. The other challenge with most of my other colleagues is that going back home is another issue, because you're scared that you'll be exposing your family to the virus itself. And we're struggling with that. A lot of us have actually taken apartments close by to the hospital, kind of tiding over this current scenario and seeing how things will pan out. We haven't probably even seen our families for the past couple of weeks.
It's tough. It's tough, Dr. Garyali, but you know what? I mean, we wish you all the best. We wish you and all the doctors there, in America, in India, all over the world, all the best. You guys are the real heroes in this fight, and we know it's not easy for you either. So thank you for doing all that you do.
Thank you. And a big shout out for the nurses.
Yes.
They're doing
all the
a
healthcare
commendable job. Yeah. Thank you very much. Take care, Nidhi.
Thanks, Dr. Garyali. Thanks very much for joining us.